Hello, and welcome to another episode of Cath Lab Did What? Today we're going to talk about catheters. As you may have seen, there are a number of different catheters available in the Cath Lab. You have your diagnostic catheters and your guide catheters. Similar but different. Your diagnostic catheters are what you're going to use for just diagnostic exams. It says it right there in the name. So these are going to be flexible, even though the French size is the same as the launchers. These diagnostic catheters are going to be thinner. They're more meant to get to the vessel so you can engage, shoot the contrast, and see if there are problems. It doesn't really necessarily have to be supportive or anything. So they're very thin, super flexible. They get in, shoot contrast, get out. Launcher or the guide catheter, they go by their name, is your guide is going to be way more sturdy. It's going to have like a braided interior. Feel a diagnostic and a launcher next to each other. You can tell the difference just by looking and feeling. The launcher is much more sturdy so that it can provide support on the back of the aorta. The whole point of a guiding catheter is to engage and hold that spot so you can put down your wires, you can put down your penumbra, you can put down your stent, you can put down your balloon. Everything goes through the pathway that is the launcher over the wire into the vessel. The launcher is much more sturdy, so you can put all of this equipment in and not puncture through your guide catheter. Depending on where you need to see, you'll use different catheters for different vessels. For example, you have your JR catheters or your Junction right. These are going to be used to see your RCA, your right coronary artery. The angle that's built on them is just specific to kind of engage that right coronary cusp of the aorta so you can get into the right coronary artery and get contrast, or even if it's a launcher, to get your wires down your right coronary artery. You also have another one called the junction left, so a JL. And this one, as you may guess, is going to be to see your left coronary system, so your left main, so you can see your left anterior descending or your left circumflex. These are going to have that angle so that you can engage in that left coronary cusp and get either angiography pictures with a diagnostic or interventional wires and equipment down if it's a launcher. They all have different angles. Your physician will call it what they want because they'll know the angles that they think will be useful. That's beyond what you really need to know as a new person into Cath Lab. What you do need to know about these catheters is they all have a number. So it's a JR35, a JL4. What does the 4, 3, 5 mean? It's just the size of the angle. So a JR3 has a smaller angle than a JR4. A EBU 35 has a smaller angle than an EBU 45. They're just the size of the angle. It's the same angle. It's just smaller or larger depending on the number that follows the name of the catheter. In addition to having a catheter specifically for your right or your left, you'll have other catheters such as an IM catheter or MPA catheter. So IM catheter is internal mammary catheter, has a very small angle on it, so you can engage that internal mammary artery. It's a very large graft artery that they'll use for bypass. If this is a patient that they're thinking about doing bypass, your physician can go engage that internal mammary artery, see if it's robust enough to do a bypass with. If they already have a graft, we'll engage that internal mammary graft to see if there's an issue with the graft and what's feeding in the heart, wood vessel, LAD, circ, whatever. The multi-purpose or the MPA has just kind of a small little curve on it, and it can be used to engage different things. It's not used too much in the heart, more peripherally, but it's a multi-purpose. It's just kind of there. It can engage different arteries depending on angle. These two don't have numbers. It's just an IMA or an MPA. They're one. There's one size it engages or it doesn't, unlike other catheters that will have different sizes. So, quick video for today. I just wanted to quickly touch base on the difference between the diagnostic and the guide or launcher, and then what the numbers meant. As always, thank you for stopping by my channel. Please leave comments below on anything you would like to learn about, and good luck.